Hi everyone, this is Ms. Romani, and for today's lesson we're going to be learning about different diagnostic technologies that were not covered in the previous lesson. Specifically, we will be learning about MRI scans, ultrasounds, and PET scans. And let's start with magnetic resonance imaging, or MRIs. Diagnostic medical technology that uses magnets, very large magnets, and a computer to produce very detailed images of the body. As you can see here from this knee MRI picture that I'm showing you, that the image that you get is much clearer than it is with a CAT scan. As I told you before, when we're looking at CAT scans use X-rays. So X-rays are fantastic at looking at contrast based on density, which with a particular good focus on very high density tissues like bones or teeth, but not so good at determining the contrast with softer tissue. Well, MRI machines do not have that issue. So you can see here, you can very clearly see the detail in the muscle and cartilage and tendons. And oftentimes when you have issues with your tendons or your muscles, it's better to get an MRI scan done. A CAT scan is not going to provide that clear an image, or an X-ray will not provide that clear an image. It is an MRI scan that will provide a very clear image for diagnosis. So what essentially an MRI machine is a giant tube. One of the issues that comes with getting an MRI scan done is that sometimes people feel very claustrophobic when they're inside the MRI machine, because you have to stay in there and you have to stay very still, and it can be very claustrophobic. Unlike the CAT scan that is just like a donut that only covers part of your body, and with an MRI scan you just have part of your body inside, but you may even have to put your entire body inside the machine. And the other reason why sometimes people find MRI scans uncomfortable is the noise. Once you're in there, the machine makes a lot of noise. It is because essentially what the machine is just a very big electromagnet that is going to create high quantities of magnetism in order to essentially align the hydrogen or protons in your body, which are found within the water molecules of your body, and align them using that giant magnet, and then essentially allowing the protons to return to the original orientation. And as they return to the original orientation, those protons are going to emit a radio frequency that is then detected by a computer. The computer will then analyze that differences in radio frequency and turn them into different images. Essentially, every single tissue in your body has water molecules. The water molecules have hydrogen atoms, which are called protons. These protons are aligned in different directions depending on the density of the tissues. When a magnet is placed along the body, then if it's done for a long enough time, all the protons in the water molecules in your body will align to be in the exact same alignment. And then once the magnetism is turned off, they will then return to the original alignment, but will do so at different speeds or different rates depending on the density of the tissue. And so a machine can then detect the frequency that these protons emit as they return to their original orientation and use that information to create an image. MRI machines are fantastic tools for determining pretty much anything that is going on in the body, but their main drawback is the fact that they're so expensive, and they're so expensive because of this radio frequency. Partly it's because the machine is expensive to build, but what is actually more expensive to the machines themselves is the infrastructure that needs to be in place where the machine can go. So there's a certain level of insulation that is required for an MRI machine to be able to work, and that is because any radio frequencies that are in the vicinity in the building will interfere with the radio frequencies that are detected by the machine in order to produce the image. That becomes extremely expensive, which lowers the number of available machines that are around, which in turn makes the machines much more difficult to get access to. So let's take a look at some of the uses for MRI scans. And to be honest, an MRI scan can actually detect any disease anywhere in the body without the need to open up the patient. So it can actually be used for almost any diagnosis. But realistically, it it's not used for just anything because they, like I said, they're very expensive and it's very hard to get an appointment to get an MRI scan done. So it is mostly used to diagnose strokes and cancers. So you can see here two images. One is actually a CAT scan and another one is an MRI scan, and they're of the same patient. This is a patient that has a brain tumor. You can see right here, this is the scan that I showed you earlier, the CAT scan, and you can see this is the MRI scan. This is the tumor right there that's seen in the CAT scan. But in the MRI scan, you can see now that there was more to that. There was just more than the one tumor. Sometimes patients will have a CAT scan done, and then they might be booked for an MRI scan as soon as they can after that in order to get a much better view of what's happening in the body. The risks of MRI scans are mostly more about the fact that the high magnetism that is created by the machine can cause flying metal objects around the machine when the machine is turned on if any stray metal is brought into the room. So they have very strict rules about bringing any sort of metal into the room, which in turn also means that patients with certain medical devices or pins or anything else that might be slightly magnetic are not able to have an MRI scan. So patients with pacemakers, metal plates, any type of medical device that is inserted into the body that has metal that is magnetic, they are not going to be able to get an MRI scan because obviously the magnetic field, it would attract those objects. Similarly, patients must remove obviously all jewelry and any kind of piercings before they get their scan done. The loud noise of the machine might also require ear protection, especially for people who work with the machines and are constantly exposed to the noise level. And contrast agents sometimes are used, just the same as they have done with CAT scans and x-rays, in order to provide different densities. And those, again, could have some side effects or allergic reactions for some patients. So then there is that risk there. Next, we're going to talk about ultrasound scans. As the name implies, this is a diagnostic technology that uses sound waves called ultrasounds to create images. These are not just regular sound waves, these are high frequency sound waves that we cannot hear, but obviously the machine can detect. And essentially what happens is the device emits an ultrasound, it is held against the body, the sound waves travel through the body and they're reflected back at different speeds depending on the type of tissue that they hit and they encounter. And so the type of tissue could be something like a heart, or it could be something like a fetus if you're trying to take a sonogram of a pregnancy. So then a computer then just detects the different rates at which the sound waves are returned and creates an image using that information. Most people associate ultrasounds to sonograms. Sonograms are basically the ultrasounds that are mostly used to monitor the health of a developing baby. It can also be used to diagnose some other medical conditions like ovarian cysts, sometimes kidney stones, sometimes prostate issues. So there's a variety of different, often pelvic issues that can be diagnosed using sonograms. Most typically, people associate them with the ultrasounds that are given to pregnant women in order to view their growing fetus. Another typical use of ultrasounds is something called an echocardiogram. An echocardiogram is basically an ultrasound scan of the heart, and it is used to diagnose the heart because it allows the doctor to actually view the heart while it's moving. Because one of the unique properties and benefits of ultrasounds is that they can actually show the live movement as it happens. You don't have to just take a picture, you can actually take a video and you can watch the movement of an object or a baby, and in this particular case, a beating heart. It is often used to diagnose things like irregular heart rhythms and some other forms of heart disease as well that can be diagnosed by taking a look at the heart while it's beating and then just seeing how the heart is moving as it's doing so. Lately, ultrasounds have become way more advanced, and they can not only get high definition 3D ultrasounds of the baby, where you can basically see, every feature, but you can also get 4D ultrasounds, which seem really crazy to me. I'm like, what is 4D? There's only literally 3 dimensions, unless you count the 4th dimension, which is time, which is essentially what it is, because a 4D ultrasound essentially is a video of a 3D ultrasound. So that's why they call it a 4D ultrasound. I was a little disappointed when I found that out. I thought there was just a little bit more to it. But turns out the 4th dimension is time. They just show it to you over time. So The risks of ultrasounds are actually very minimal. This is the reason why we use them for diagnosing fetal abnormalities in the womb or just assessing the health of the fetus. There is no risk to the patient that we know of. There might be, perhaps, some occupational hazards with an increased risk of hearing loss for ultrasound technicians. Very rare, and there's not a lot of evidence to back it up, but it is, I guess, potentially a risk because you have high frequency sound waves that maybe under the quantity of time that an ultrasound technician uses them might pose a risk. Well, we're not sure. So the last type of technology is called PET scans or positron emission tomography scans. This one uses nuclear medicine or nuclear diagnostic medicine in this particular case. So nuclear medicine uses something called radioactive atoms or radioisotopes. And just a quick lesson on radioisotopes. Some of you have learned about this in chemistry class or in physics class. Sometimes atoms, well, actually all atoms, have what are called isotopes. And isotopes are basically versions of the atom that have different number of neutrons. And a very slight, very tiny percentage of those isotopes tend to be oftentimes very heavy isotopes. They have extra neutrons and they are also radioactive. And radioactive isotopes are those isotopes that can decay, which means that their nucleus is not stable. For most atoms, the nucleus is extremely stable, the most stable part of the atom. I mean, electrons can be given away or taken in or shared, and this is how chemical reactions happen. And the nucleus does not change, except for with radioisotopes. Radioisotopes have very unstable nuclei, and so the nuclei can emit particles, and those particles can be positively charged particles called positrons, or sometimes negatively charged particles. And so in this particular case, we're going to take a look at what happens when we have these positron emitting radioisotopes that are going to be emitting these positive particles that can then be detected by a machine called a PET scan. And so a PET scan is a type of nuclear medicine machine that is used for diagnosing patients. The machine is not radioactive, but the machine is able to detect radioactivity. So a patient is placed into the machine, and the machine is turned on, and the machine is going to detect radioactivity. But most patients are not radioactive. Most patients are normal. So what's the machine going to detect? Well, in order for the machine to work, we first need to make the patient radioactive. That's right. We make a patient radioactive in order for us to diagnose disease. And so what is usually done is a patient is then given the radioisotope, oftentimes by injection. Sometimes they drink it in. There's a variety of different ways of introducing it into the body. And so a tracer, oftentimes a radioactive version of glucose or sugar, but it could be some other types of radioactive substances as well, are introduced into the patient and given some time to move through the body. And once enough time has been given so that the radioactive tracer has moved through the patient's body, now the patient is radioactive. They can go under the machine, and the machine is going to detect the radioactivity that is going to be emitted as these positrons, as positive particles that are emitted from the nuclei of this radioisotopes, and then the PET scan can detect. And so as a radioisotope is emitted as radiation, the camera or in computer of the machine of the PET scan can detect that radiation. And areas with greater concentration of the radioisotope are going to then appear as sort of either darker areas or differently colored areas in the machine, depending if you're using a black and white sort of image or a more colored image of a variety of different types. So the machine can basically detect the absorption level of the radioisotope. The patient is given the radioactive element into their body. It is absorbed into their tissues. It is absorbed into their tissues in different amounts, depending on the metabolic rate of the tissues. And then areas of the body that have absorbed the most of that radioactive tracer will appear in the scan as what are called hotspots. And these hotspots are basically the areas in the body where the radioactive element has concentrated. So let's take a look at this image right here. this person has a tumor. And you can see in the first scan, there's 3 areas that appear as hotspots. You can see that there's a huge amount of the tracer that is in the brain of the patient. You can see that there is small amounts where that arrow is pointing right there, and then another huge chunk of concentration in the middle. So now, at first this might look really scary that this patient is just riddled with brain cancer and some sort of other abdominal cancer, and then just a little bit of a tumor above. But that's not the case. So in this particular case, it most likely was a radioactive glucose that was used. And the reason that I know that is because so much of it was absorbed by the brain, because the brain loves sugar. And so a radioactive tracer of glucose is going to accumulate in large quantities in the brain. And that doesn't mean that there's cancer in the brain. It just means that the brain loves sugar, so it's going to absorb a lot of the glucose. The other part where the tracer is found in high quantities is in the bladder. And so that very big black spot right there in the middle, that's the bladder. And that's because the tracer is eliminated in the urine. And so that's why it's there. Now, different types of tracers can be used for different types of scans. So for example, another common radioactive tracer that is used is iodine, obviously a radioactive form of iodine that is used to detect problems with the thyroid gland. And the thyroid gland is a gland that we have in our throat. On the right, you see the picture of, on the top, it says A. That's actually the shape of the normal thyroid gland. And this is what it would look like if the radioactive iodine had been absorbed normally by a thyroid gland. So the thyroid gland is the only place in our body that uses iodine. Nowhere else in our body do we use iodine. And so radioactive iodine is very helpful at detecting problems with the thyroid gland because it accumulates there. And so if you have an overactive thyroid, an underactive thyroid, an infection in your thyroid gland, or some sort of thyroid cancer, then that can be detected using radioactive iodine that is then absorbed only in the thyroid gland. Bone cancer that are not easily detectable with other scans because they don't necessarily show as distinct tumors are also easily detected, and PET scans are very helpful for detecting them. Again, the black area in the middle, that's the bladder. We can ignore that, but you cannot ignore all the areas of the bone that obviously shows a lot of the cancer. So why is it that we can use this type of radioactive tracer to detect cancers? Why is cancer easily detectable as hotspots in these scans? Well, the reason for that is because cancer cells have a much higher metabolic rate than normal cells. And so they will absorb radioisotopes faster than they will normal cells just because they metabolize things faster. So if, for example, then the radioactive isotope that you're giving the patient is, say, a radioactive glucose, well, cancer cells love sugar, and they're eating the sugar as a form of fuel. And they're not necessarily looking out for radioactive molecules, they're just eating the sugar that is being provided. And because they eat it in higher quantities at a faster rate than the surrounding tissue cells, then they will accumulate the radioisotope faster. So because cancer cells have much, much higher metabolic rate than other cells, then any substance that you put in your body that cells normally will absorb, cancer cells will absorb in higher quantities. So cancer cells will appear as hotspots. PET scans are the only type of diagnostic technology that we've discussed that do not actually give you an image based on tissue density. They give you an image based on tissue metabolism, how the tissue works. Tissues that are, or cells that are working faster are going to accumulate more of the radioisotopes than cells that are working slower. In the case of the iodine in the thyroid gland absorbs the iodine as it undergoes its own metabolic processes, as it undergoes its own chemical reactions. So we'll absorb it at normal rates or slower or faster rates depending on the problem. And then when it comes to cancer, obviously it is absorbed at higher rates if there is cancer. PET scans can also be used to detect heart disease and brain disorders like Alzheimer's disease or epilepsy, sometimes because they can detect brain activity by basically detecting the metabolic activity of the different parts of the brain. So if a tracer that is absorbed in brain tissue is used, they can then detect which areas of the brain are absorbing it at a higher rate. Therefore, you can detect the levels of brain function. They can also be used to detect heart disease because you can also inject a radioactive dye into the bloodstream of the patient, and then wherever the blood goes, the radiation goes, and so therefore the scan can give an idea if there's any blockages or anything like that based on the movement of the reactive tracer. So they can also be used to investigate blood circulation or evaluate other disorders in organs just by basically following a radioactive tracer through the body. Now, the risks obviously is exposure to radiation. The radiation that is used is going to be more dangerous than X-rays, but the radiation use is low. They obviously are not going to be using extremely radioactive elements, and the half-life of the radioactive tracers is very short. What does that mean, the half-life? Half-life is the amount of time that a radioactive element is radioactive for. As the radioactive element decays, as its nucleus breaks apart, it stops being radioactive. But the amount of time that it takes, say, for half of a certain quantity of the material to go from radioactive to non-radioactive, that's what we call the half-life. And so some radioactive materials have half-lives in the thousands of years. Obviously, you wouldn't use that for a patient, but you can use some materials that have shorter half-lives, like minutes, hours, days. Sometimes patients might have an allergic reaction to the tracer, just like with other technologies that use tracers, occasionally allergies or some other sort of reactions to it. So this is it. That's the end of the diagnostic technologies lessons. And the next lesson will be a lesson on vital signs. Talk to you soon. Bye.